Hello and welcome to the Freshwell Diabetes Programme in association with the Freshwell Low Carb Project. My name is Dr. Kim Andrews and I am a GP in Finchingfield in Essex and also a GP with a special interest in diabetes. Today I'm going to talk you through an introduction to diabetes, and this might be useful if you've recently been diagnosed and want to understand more, or if you may have had it for some time but want to know more about what you can do to help yourself to improve your diabetes control. Just as a quick disclaimer, this presentation should be classed as information only and not personal medical advice, and you should always check with your doctor or nurse before starting any new lifestyle changes, particularly if you suffer from any long-term health conditions, eating disorders, if you're pregnant, breastfeeding, or under the age of 18. And this is particularly true if you take any long-term medications, especially for type 2 diabetes or blood pressure, as you may well need to reduce your medication. So let's take a look at diabetes. There are currently over 3.2 million people diagnosed with diabetes in the UK. And in fact, recent numbers have shown that 1 in 10 people over the age of 40 have a diagnosis. Around 90% of those people diagnosed with diabetes have type 2 diabetes. And this is more common, again, in people of African, Afro-Caribbean and South Asian origin. Type 2 diabetes can be caused by various factors, ones that we control and ones that we can't. So certainly diet plays a part, our weight plays a part, inactivity, genetics, and medication that we take can also sometimes lead to type 2 diabetes. There are ways of maintaining good control and helping your control of diabetes to be good, and methods include, being well educated on it, knowing what will affect your blood sugar, knowing what in your lifestyle will make your sugar higher or lower, and also maintaining very good blood pressure control and good control of your blood sugar. So what is diabetes? Essentially, diabetes is a disease which is caused by either a lack of or reduced effectiveness of a hormone produced by our body called insulin. And it's essentially characterized by raised blood sugar. There are generally two main types that most people think of. These are type 1 diabetes, where there is an absolute deficiency of insulin. People do not produce insulin and they need to be given that. The other type, the more common type, is type 2 diabetes, and this is essentially caused by people becoming very resistant to their own amounts of insulin, so they need higher and higher levels of insulin to get the effect that they need. And you can think about it as being a lock and key event, where basically you want the blood glucose to go into the body cells, and there are little locks on these cells, and insulin is the key that will open those locks and allow the glucose to be taken up into the cell. And obviously, if the glucose isn't being taken up into the cell, then the levels in the blood are going up and up and up. And symptoms of high blood glucose include being very thirsty, peeing a lot, losing weight because the body can't actually utilize that blood sugar even though it's there. People feel very tired, and they can also get recurrent infections, particularly sort of thrush in the mouth or in the genital area. And what are the complications of diabetes? Well, very broadly, they can be put into two categories. That is macrovascular, and this is the effect of the blood glucose on the large blood vessels, and these can cause problems such as heart disease, vascular disease peripherally, where we get clogging up in our arteries of our legs, and also stroke, which is a problem with the blood vessels in the brain. Then the second classification is generally microvascular complications, and this is caused by damage to the small blood vessels in the body. And these complications tend to occur at the back of the eye in the retina, retinopathy, within our kidneys, which is called nephropathy, and also neuropathy, which is an effect of the blood glucose on our nerves. And all of these complications can be prevented or minimized with good blood pressure and sugar control. So what can you do to help? Well, certainly diet plays a huge part in controlling your blood sugar levels, and we will talk about that a little bit later. Exercise, as well as being great for mental health and cardiovascular disease, will also help to bring your blood sugar down, as you need that energy from the sugar to exercise. And also drinking alcohol within safe limits, which is currently around 14 units a week for men and women, which is roughly equivalent to around 7 pints of beer, 7 glasses of wine a week. You should stop smoking if you are smoking, or certainly not start. And in terms of your healthcare, you should take the medication prescribed to you on a regular basis and attend your GP or hospital for checks when you are called up. And as a minimum, I would suggest that these should be annually, at least once a year. You will also be offered a flu vaccination once a year, as your risk of complications from influenza is a little bit higher than people without diabetes. And the other thing just to think about is informing the DVLA. This isn't for everybody, but certainly if you're put on any form of medication that is going to affect your blood glucose, the DVLA would like to know, and it's important that you do that for insurance purposes. So what about education and lifestyle? Well, we've put together lots of educational resources to help you better understand your diabetes and the ways that you are able to control it and gain good control. So please do take time to look through those. And in terms of your lifestyle, as we talked about earlier, poor lifestyle choices can contribute to both developing type 2 diabetes and poor control of diabetes. And certainly following a healthy diet, which we will talk about later, and keeping yourself active will help with your long-term blood sugar control, which over time will reduce your risk of complications. So let's spend a little bit of time talking about diet. A balanced diet. What is a balanced diet? Well, our foods are made up of 3 different macronutrients: proteins, fats and carbohydrates, and also micronutrients, which is the vitamins and minerals. And when we talk about carbohydrates, we are talking about both sugar and starch. And when we talk about sugar, we are talking about that white stuff that we spoon into our tea and coffee, or that we might add to cereal, or that we might eat in biscuits and cakes and sweets. And obviously we know that these are going to push up our blood sugar and are not that great for us. We also, when we think about sugar, need to think about naturally occurring sugars in, say, fruit or fruit juices or milk, as these will also affect your blood sugar. And also when we think about starch, starchy carbohydrates, so this includes things like breakfast cereals, porridge oats, anything made with flour, like bread, also rice, potatoes, pasta. These are starchy carbohydrates, and when these get into your body, they will be broken down into glucose molecules. And so people are often shocked when I tell them that there is at least 3 to 4 teaspoons equivalent of sugar in a slice of bread. So obviously if you're having a sandwich with 2 slices of bread, you're looking at around 8 teaspoons of sugar, and that is going to affect your blood sugar. So as well as the sugars, it's important to think about the starchy carbohydrates. Thinking about protein, so this is meat, fish, cheese, eggs and pulses, and also fat-containing foods like cream, oil and butter. These contain little or no carbs, and therefore have a far less effect on our blood sugar. And so, it depends on what we are consuming, how many carbohydrates we're eating, what sort of carbohydrate we're eating, which will lead to our blood sugar variating. And there is also something known as the glycemic index, and this is to do with how quickly the sugar is released from the foods that we're eating, and will have an effect on our blood sugar. And essentially, if you are eating carbohydrates, you are better going for the ones with a lower glycemic index, because these are going to be released into your bloodstream much more slowly, and therefore will have a less profound effect on your blood sugar readings. So what does this mean? So basically, eating well will help you to manage your weight, control the symptoms of your diabetes, of a high blood sugar, and help you have more energy to be able to get done what you need to. The current recommendations are to choose a source of protein as the bulk of the meal, and certainly you're looking at meat, fish, eggs, cheese, for example, and also to aim for 2 portions of fish each week, such as mackerel or salmon or tuna, and really trying to avoid those foods that are high in starch and sugar, as they are going to have the largest effect on your blood glucose level. So what about exercise? So physical activity can certainly help to improve our diabetes control, as when we are physically active, the blood glucose is taken up into our cells and used for energy, which causes our blood sugar to fall. And exercise can also help improve our body's insulin response, as it reduces resistance to that insulin. So in terms of tips for exercise, you don't have to be going to the gym every day. You don't need to be going to classes and working out and getting horribly sweaty. You should just incorporate generalized movement into your daily routine. Walk whenever you're able instead of getting into the car. If you need a bit of encouragement, consider having a step counter or using your watch to keep a daily goal, aiming for around 10,000 steps a day. Ask somebody to do it with you. Get a friend to come out for a walk with you, and that holds you accountable and means it's also more enjoyable to be out there chatting with somebody whilst you do it. And in terms of the benefits of exercise, as we've talked about, it will bring down your blood glucose, and it also helps to strengthen your bones. It improves your cardiovascular health and also will help to reduce your blood pressure. And as well as that, it makes us just feel better in ourselves. It improves our mood, increases our energy levels and our confidence and our general sense of well-being. The current recommendations are to complete around 2.5 hours of moderate exercise a week, which could be walking, housework, etc., or around 1.5 hours of vigorous exercise a week, where you're really getting your heart rate up and getting a bit hot and sweaty. So let's talk about hypoglycemia. What is a hypoglycemic episode? And you might hear your healthcare professional talking about a hypo, and essentially in that situation they are talking about hypoglycemia. And this is a situation where your blood sugar falls to below 4. And I like to remember that by saying 4 is the floor. And common causes of this occurring are having too much diabetes medication, so having a too high dose of the tablets that you're taking in comparison to your exercise and food, which is causing your blood sugar to fall. Doing too much exercise, for example, you've planned to do a walk for 45 minutes, but you actually end up staying up for 2 hours, and that will cause your blood sugar to fall. And also either not eating quite enough for your meal before that exercise, or before your daily activity, or having that meal late. So for example, you would normally have your meal your lunchtime meal at around 1, but on this occasion you've got caught up in something else and maybe haven't managed to sit down until 2:30 or so. So that's a problem and could cause your blood sugar to fall if you are on medication that would cause that to happen. And the sorts of symptoms that you're looking out for are feeling hot or sweaty, a bit shaky, having trouble with concentration, feeling a little confused, having, poor coordination, stumbling a little bit, your speech slurring. You might also feel a little bit irritable or get some feelings of dizziness or lightheadedness and tingling in your hands and feet. And often you can almost look like you're drunk. A lot of people sort of stagger around and aren't really quite making sense. And so sometimes there have been occasions where people suffering hypos when out in public have been thought of as being drunk, and a lot of people wear a little alert bracelet so that in those sorts of situations people know that actually the problem could well be blood sugar and nothing to do with alcohol. So if your blood sugar is falling low and you are starting to sense any of these symptoms, what should you do? Well, first of all, you should always carry with you a form of quick-acting glucose. And for most people, that includes sort of 4 or 5 jelly babies, 3 or 4 dextrose tablets. They're things that can be quite easily held in your pocket or in your handbag, or in the glove compartment of your car. So those are certainly things to carry with you. Also, if you're at home, certainly 200 mils of, say, fruit juice, or a non-diet soda like cola or lemonade will also help to bring the sugar up, but don't overdo it. You should check your blood sugar in around 10 to 15 minutes after treating to check that it is coming up. But if it isn't coming up, you can repeat that sugary load. Once your sugar is starting to rise, you should have something to eat, a slow glycemic index releasing food. So certainly if you were about to have your meal, go ahead and have that meal. If you weren't going to have that meal, maybe follow it up with a glass of milk, or a slice of wholemeal bread, or something like that, to just slowly release some blood sugar and keep your sugar raised. Otherwise, what you'll find is as soon as that quick acting glucose is out of your system, your blood sugar is going to plummet back down again. If the problem has got so far that you have become unconscious, or you can't really swallow, then you shouldn't be consuming anything to eat or drink, as it's possible that you should choke on it. So if you have a glucagon injection at home, you should make sure that your loved ones, your friends, are aware of how to give that to you, or if they aren't able, or if you don't have that with you at home, then certainly calling 999 for an ambulance to come and treat you and get that blood sugar up is really, really important. And it's also just important to remember that after suffering a hypo, you really should not be driving for at least 45 minutes. And also, unless you've missed a meal or you overexercise that day, if it's a medication problem, it is certainly worth talking to your doctor or your specialist nurse about your treatment, about your hypoglycemia, as they may well be able to adjust your medication or give you advice on how to avoid these, because they're really not very pleasant and can be quite dangerous, for example, if they're occurring whilst you're cycling a bike, driving a car. So diabetes and driving, as I said, on diagnosis, if you're put on medication that affects your blood glucose, you should certainly inform the DVLA. And essentially, I use the memo 5 to drive, and that is really to say that you need to test your blood glucose before you get in your vehicle, and it needs to be above 5 for you to consider driving. And if it isn't, you need to come in, you need to eat something, wait for your sugar to come up, and then you'll be ready to do so. So obviously it's really important to have a blood glucose monitor, and if you are driving on long journeys, you certainly need to have that with you, and you need to be checking that every 2 hours or so when you're on the road. You should keep some method of sort of very quick sugar replacement in your glove compartment, and for most people that's a bag of Jelly Babies or some dextrose tablets. And it is important to remember that if you are feeling odd when you are driving, not right, feeling sweaty, like something isn't right, you certainly need to be stopping the car. And it's very important that you pull over safely and that you remove yourself from the driving seat and take the key from the ignition, to prove that you were not driving the car and that you have not been driving dangerously. The rules are very slightly different for HGV drivers, but more recently the rules have changed, whereas previously, once you were on insulin, for example, you couldn't be driving an HGV. Those rules have changed, but instead they've slightly tightened up on the monitoring rules, and you need to use a blood glucose monitor with a recording memory function to prove that you have been checking, and in the event of an accident, the police would ask you for that monitor and would assess your readings. So let's move on to sick rules. How should you manage your diabetes if you are feeling unwell? And these are what we call the sick day rules. And most importantly, it is really important that you do not stop taking your insulin or your diabetes medications. A lot of people think, well, I feel really ill, I haven't eaten anything, and therefore I'm not going to take my medication. But that is not the right thing to do. When you are ill, your blood sugar levels, because of the stress on your body, pushes your blood sugar up. So it is Really, really important to take your medication, and you may even need more than normal. So you must keep taking that medication. The other problem that often occurs is dehydration. And so you need to make sure that you are drinking plenty of water to prevent that from happening. And normally you should be aiming for around 2.5 litres a day, which may be a little bit more if you are sweating a lot or losing a lot of fluid, say, for example, with vomiting or diarrhea. Every 100 mils every hour or so, 2.5 litres a day. Eat as normally as you can. I do appreciate sometimes when you don't feel well, you don't want to eat, but try and get down a little something if you are able. Rest and avoid doing any form of strenuous exercise, which is only really going to make you feel worse if you're feeling poorly. And you need to be checking your blood sugar levels regularly, which normally is around 2 hourly, but it may be more than that if your sugar levels are very high, or if you really are feeling very unwell, are unable to eat or drink. So when should you seek medical help? Well, if you're experiencing continuous diarrhea and vomiting, so you can't keep down your medication, you can't keep down any fluids, you need to be calling for help. If your fever is very, very high as well, and it's worth checking with somebody. And if you've been unable to keep down food or liquid for 4 hours or more, again, that is going to have a detrimental effect on your blood sugar, and you should be speaking to a healthcare professional for advice. And if your glucose levels are going very high, up into the high teens and 20s, that would also be worth discussion with your healthcare professional to see if there's anything else that can be tweaked to improve the situation. Some people also have access to ketone testing, both in their urine or in their blood, and you may have a specialist meter or sticks to do that. And certainly if there are more than 2 pluses of ketones in your urine, or if your blood ketones are over 1.5 millimoles on your meter, then again you should be seeking medical advice. So let's talk a little bit about blood pressure and glucose control. Blood pressure is extremely important in diabetes to prevent long-term complications, and as a minimum should be taken at least once a year, more often if possible. Particularly, it's worth having a meter at home, and every now and again just doing that blood pressure and bringing it to the attention of your healthcare professional if it's too high. And we know that good blood pressure control will reduce the risk of long-term complications from diabetes and can also reduce your risk of heart disease and stroke. And as well as blood pressure being reduced through weight loss and exercise, medication is sometimes also used if we're unable to attain the blood pressure that we need through those routes. And sugar control and glucose control, this is what you measure when you're using your little home machine with the strips, and that gives you a moment in time of what your blood glucose is doing. What your healthcare professional does is use a test called an HbA1c, which basically looks for the way that glucose is attached to your red blood cells, and it gives us an idea of how well your blood glucose has been controlled over approximately the last 8 to 12 weeks. And again, our blood glucose, as we've talked about, can be controlled through both lifestyle improvements such as what we're eating and what we're doing, and also with medication. So measuring blood pressure is certainly something that you can do at home, and may indeed be something you've done during the coronavirus lockdown, as you've been unable to access the medical treatment you might normally have. And they are the monitors nowadays are very easily available online or at your local chemist, and can provide extremely good results and are very helpful. So may well be worth purchasing one of your own to be able to check your blood pressure. If you're doing it at home, aim to do it at roughly the same time every day. Wear a top with loose sleeves, which can be easily rolled up to expose your upper arm. You don't want the sleeve to be cutting off your circulation, so make sure it's quite loose, or that could affect your blood pressure readings. Make sure you're sitting comfortably in a chair and feeling relaxed, and you might need to sit there for 5 minutes quietly or so before taking your blood pressure. If you can, try and rest your arm on a cushion or a chair arm so that it's around the level of your heart. When taking your blood pressure, obviously, Roll up your sleeves, stretch your arm out straight with your palm facing upwards. Place the blood pressure cuff around your bare arm, making sure it's the right size, and it should fit quite nicely in the central part of your arm, and there should be sort of a couple of centimeters above your elbow there to the cuff. Don't pull it too tight. You should be able to fit a couple of fingertips under there. And in terms of the cuff, it needs to be the right size. If it's too big, the blood pressure reading will be too low, and if it's too tight, it could make the blood pressure reading too high. Once you're sat there, you've got the cuff on comfortably, press the start button on the monitor and with your other hand, and then don't talk or move. It's sometimes I find myself chatting to people, but that will put their blood pressure up. So it is hot. It is you need to sit there, not talk, be quiet whilst it's taking the reading. You'll feel the cuff tighten, and then it will start to slowly deflate, and then the blood pressure reading will appear on the machine. And often people ask me, well, what do those readings mean? And essentially the top number is what we call the systolic blood pressure, and that's the pressure at which the blood is being squeezed out of your heart. And the lower number is what we call the diastolic blood pressure, and that's the pressure in your heart once the muscles have relaxed. And both of those numbers are important. Essentially, generally, you're aiming for a number around 140 or less for the top number, and for the bottom number around 80 or less, ideally. So what sort of health checks might you have if you have diabetes? It's important to have regular blood checks to monitor your diabetes and to help us look for any signs of any complications. So what are these checks that are used? Well, the one I talked about previously, the HbA1c, this is an important one and is something that will be measured, 2 or 3 times a year, or potentially even more than that, to check what your blood glucose has been on average over the last 2 to 3 months. Blood pressure would be taken again, at least once a year. And if the blood pressure is high, you will certainly be advised on lifestyle methods or medication to bring that blood pressure down to prevent complications. You will also have further blood tests which will check for things like your cholesterol and lipid levels, and also how well your kidneys are functioning. You will also be called up for an annual eye check, otherwise known as diabetic retinal screening, and this is where they have a look at the blood vessels at the back of your eyes, looking for any damage there. And as obviously, damage to your eye is not what we want, can cause blindness, so really, really important to get those checks done. And if you do get any deterioration in your sight between your eye checks, you should certainly be speaking to your doctor or nurse or seeing an optician as soon as you can to get that checked out. You will also be called up for a yearly foot check, and that is looking for damage to both the blood vessels and the nerves in the feet, and that will involve taking your shoes and socks off, having a good look at the condition of the skin, checking the pulses in your feet, and also checking the sensation in your feet. You'll also likely be weighed, and this is to check your BMI to ensure that it's within a healthy range, as obviously the higher the BMI is, as we talked about earlier, the more resistant you're likely to be to the insulin, and the poorer your diabetic control, leading to complications. So getting your eyes checked, eye screening, as I talked about, is a really important part of a diabetic check, and you will be called up around once yearly to have this done. And when they're doing this test, they are looking for this condition called diabetic retinopathy, which is a condition that affects the small blood vessels at the back of your eye in the retina. This is where the blood vessels can become either blocked or they can bleed and leak, which causes damage to the retina and therefore reduces your vision. And it is actually the most common cause of blindness in the Western world. So the important thing to remember is that if you have good control of your diabetes and good blood pressure control, this is much, much, much less likely to be a problem for you. And even if you do develop signs of eye disease, this can be improved with improving your diabetic control. It isn't quite the same as going to the optician, so don't think, well, I've been to the opticians this year, I don't need this to be done. You do still need this to be done. This isn't something generally done by opticians, and it's a separate check, so please do go up for that appointment when you're called. The check basically generally involves having some drops put into your eye and somebody using a very big machine to take a photograph of the back of your eye, and then you will get a report, and a report will be sent to your GP around 6 to 8 weeks after that's done. Risks of diabetic retinopathy, as I said, can be reduced by controlling your blood glucose as well as you can, keeping your blood pressure within the target range, and taking your medication as it is prescribed. So what about feet? As I said, you'll be called up for an annual foot check, and that is because people with diabetes have a greater risk of developing problems with their feet. And this is because of two things, or a combination of those two things. Firstly, the larger blood vessels narrowing and therefore less blood getting to your feet, or the nerves in your feet being damaged by persistently raised blood glucose levels. And when these things happen, this can cause wounds to heal very slowly, increase the risk of infection getting in. If the blood supply really becomes dangerously low, this puts us at risk of gangrene and I suppose potentially the complication of actually having to have a toe or even a foot removed. So, you know, it's really, really important to look after your feet. And as I said, sometimes the blood glucose affects the nerves, and that actually means that we can't feel what's going on in our feet. So that's obviously even more dangerous, because if, for example, our shoes are rubbing and we're getting a blister, or we're walking on the beach and we cut our foot on a shell, you know, we aren't going to feel that, and that is going to be a real problem. So important things are, you know, if you are losing sensation in your feet, you certainly should never go barefoot. You know, I'm afraid even if you're on a beach, you should be wearing some sandals, and you need to be checking your feet every single night, you know, taking your shoes and socks off before you go to bed and having a good look at the soles of your feet in between your toes and around your heels, as that's often where wounds start to form. Often as well, we can get quite cracked skin on our feet, very cracked, dry skin. And again, this increases the risk of infection getting in. And you want to try and treat that with some over-the-counter creams to really soften that skin up and stop it from cracking. And if you get things like corns, calluses, blisters, these are signs that there is friction on your foot, and that should make you reassess the footwear that you're wearing, because what you're wearing currently probably is not the right thing for you. And if your blood sugar is high, you're also at greater risk of athlete's foot, which is a fungal infection, which often makes you get very sort of itchy, red, soft skin in between your toes. And again, you know, you want to pick this up quickly, and that can easily be treated with over-the-counter sprays and powders. There is something called the touch the toe test, which helps you to assess your own sensation in your feet in the comfort of your own home. And essentially, if you're laying down with your eyes closed comfortably, and you will need someone to help, a kind assistant, who should touch 6 of your toes very lightly on the tip of your toes, briefly for 1 or 2 seconds. And every time you feel somebody touching your toes, you need to alert them to that. You don't get to have a second chance. You know, if you don't feel it the first time, that counts as a negative. And if you are able to sense that, then that is great. But if you're sensing of the 6 times your toes are touched 4 times or less, then that does increase your risk of having damage to your feet that you might not feel. So if you find that that is the case, I would again pop along, maybe see your diabetic nurse, let her complete a full assessment again for you and give you advice if she agrees that your sensation is reduced. So in terms of the kidneys are 2 organs that sit in our lower back, and these are basically filtering blood for us 24 hours a day, removing the waste products, which we then pee out in our urine. And at the edges of the kidneys, there are these tiny blood vessels in little bundles called glomeruli, and this is where the filtration takes place. And we are able to monitor how well the kidneys are working by checking a level called urea and creatinine. And these are levels of a waste product that will build up, and the levels will raise up if the kidneys are not working properly and are potentially damaged by blood sugar and blood pressure. We take a blood test to look for that, and they then use that to calculate something called your EGFR, which stands for estimated glomerular filtration rate. And generally we want that to be over around 60, and as we get older or as the kidneys are damaged, that level will start to fall. And once the kidneys are damaged, this is something that we call diabetic nephropathy, and this can cause a problem with filtration, whereas normally if you think about your kidneys as being a sieve, the holes in those sieves are really very tiny, so there shouldn't be any protein molecules getting through those sieve holes. When the kidneys are damaged in diabetes, those holes of the sieve get much larger, and therefore the protein can fit through those sieve holes, and that means that we can detect protein in the urine, which is a sign that there is kidney damage. You will find that your healthcare professional will ask you to provide a urine sample every year, an early morning sample, the first wee of the day, and they will also send that to the lab looking for protein within it, and that is a very important test again. And also as time of damage goes on, we start to get scars in the kidneys, and again this causes the filtration to reduce, and again those creatinine levels start to rise. So risk factors, certainly poor glucose control, poor blood pressure control, the length of time you've had diabetes. Often once you've had it for 20 or 30 years, there is going to be a degree of damage in all likelihood, unless you really have had perfect control over the years. And lifestyle changes such as bringing your blood pressure down, bringing your blood glucose down, can all help maintain your kidney function and prevent progression of disease. And as a person with diabetes, unfortunately, you do also have an increased risk of suffering with angina or a heart attack or a stroke. But again, the better you look after yourself and your diabetes, the less likely these complications are to occur. And certainly if you smoke, you should absolutely stop, and certainly not start. We need to make sure that you're controlling your blood glucose well, and also particularly checking that your blood pressure is being maintained at those magic numbers of less than 140 and 180. And we can do this again through changes to diet and lifestyle, weight loss, and also through medication if you need to take it. So what about pregnancy? As time is going on, we're finding that there are younger and younger people being diagnosed with type 2 diabetes, and obviously this is now affecting women of childbearing age. So if you do have diabetes and you are thinking about getting pregnant within the next year, it is important to speak to your healthcare professional to get some pre-conception advice, to make sure that you're in the best possible situation for you and your baby when you get pregnant. And essentially we want to do this because unfortunately diabetes and having raised blood glucose can have a detrimental effect on your pregnancy and potentially on your growing baby. And so you want to try and minimize those risks as much as possible. And certainly for the 6 months or so running up to becoming pregnant, you would want to be keeping as tight a blood sugar control as you are, maintaining an excellent blood pressure, a normal weight. And also another important thing is to start folic acid, and for most of the population that's recommended at a dose of 400 micrograms a day, but for those people with diabetes, actually the recommended dose is 5 milligrams a day, and that is going to be something you will need to get on prescription from your doctor. If you do have diabetes and become pregnant, it is even more important for you to maintain very tight blood glucose control, and you will be referred on to a specialist team at the hospital to help you with that. It's very, very important, and you can do that through diet and may also be prescribed medication to help you keep your blood sugar readings as tight as possible. You will also have additional blood tests taken during your pregnancy to check your overall health as well as your kidneys and diabetic control, and you will also have some extra retinal screening as often when the blood sugar change during pregnancy, certainly at the beginning when they're very tight, this can cause sudden changes in the back of your eye, so they would want to monitor those quite closely. You may also need to change some of your medication taken for diabetes or high blood pressure, as all these medications aren't necessarily safe in pregnancy. So again, this is very important, something to talk about to your doctor if you're thinking about becoming pregnant, because they may suggest changes to your medication there and then. And certainly if you find out you're pregnant unexpectedly, you need to get in touch with your healthcare provider so they can advise you on any medication that needs to be changed or stopped. And as I said, folic acid, the 5 milligram dose, which is slightly higher than what's recommended for a woman without diabetes. So that brings us to the end of the introduction to diabetes. I hope that has been useful and has given you a better understanding of what diabetes is, the problems it can cause, and what you can do to best control it and prevent any risk of long-term complications. Please do feel free to sign up to our low carb program, and this, as discussed in diet, can be a really, really powerful and useful way of controlling your blood sugars and preventing long-term complications, and potentially preventing the need for medication if you're able to bring your blood glucose down to normal levels through diet and lifestyle changes. And you can find that advice there on the website given, or through that QR code there. So please do get in touch, have a look at our other resources, and hopefully you'll either put your diabetes into remission or be able to maintain excellent control and live a long and healthy life. So thank you very much for listening, and take care. Bye-bye.